I'm Dr. Jonathan Hayes, and I've been an endocrinologist at Metropolitan Medical Institute in Phoenix, Arizona for 16 years, or at least I was, until I submitted my resignation 2 months ago. During my career, I've treated over 4,500 patients with diabetes, thyroid disorders, hormonal imbalances, and endocrine conditions that can devastate lives if left untreated. I've witnessed the incredible power of hormones to control every aspect of human physiology and helped patients reclaim their lives through precise hormonal interventions. But what I'm about to tell you about is the one case that made me question everything I thought I knew about human hormones, aging, and the very limits of what the endocrine system can accomplish. Metropolitan Medical Institute is a premier endocrine specialty center serving the southwest region of Arizona, Nevada, and New Mexico. As the director of hormonal research and clinical endocrinology, I've encountered every hormonal disorder in the medical textbooks. Severe diabetes requiring complex insulin protocols that can mean the difference between life and death within hours. Thyroid storms that can kill a patient in less than 24 hours if not treated immediately. Rare pituitary tumors affecting growth and development that can destroy a child's future if not caught early. Hormonal cancers that require aggressive treatment protocols and split-second decision-making. The human endocrine system is incredibly complex, a network of glands producing dozens of hormones that regulate everything from your heart rate to your ability to process sugar, from your sleep patterns to your capacity to handle stress, from your sexual function to your body's ability to grow and repair tissue. When the system malfunctions, the results can be catastrophic and swift. But when it works properly, it's nothing short of miraculous. Over my 16-year career, I've seen medical miracles that still give me chills. I've watched 12-year-olds with growth hormone deficiencies grow 8 inches in a single year with proper treatment, transforming from the shortest kid in class to normal height. I've seen diabetics on the verge of diabetic coma, with blood sugar levels over 800 mg/dl, return to completely normal lives within weeks of proper insulin management. I've helped menopausal women suffering from debilitating hot flashes, bone loss and depression regain their vitality and zest for life through carefully calibrated hormone replacement therapy. I've treated men with testosterone deficiency so severe they couldn't get out of bed, who rediscovered their strength, energy and sense of purpose within months of treatment. I've seen children with rare genetic disorders affecting their adrenal glands grow up to live normal, healthy lives because we caught their condition early and provided the right hormonal support. But perhaps most importantly, I've learned to respect the delicate balance that governs human hormones. A few micrograms too much or too little of certain hormones can mean the difference between health and disease, between normal development and severe dysfunction, between life and death. The endocrine system operates on incredibly precise levels. We're talking about concentrations measured in parts per billion that can have profound effects on every cell in the human body. This precision is what makes endocrinology both fascinating and humbling. Unlike other medical specialties where you might see immediate, obvious results, hormonal medicine often requires patience, careful monitoring and gradual adjustments. Hormones work slowly but profoundly, changing patients from the inside out at the cellular level. But nothing in my extensive training at Johns Hopkins, my residency at Mayo Clinic, my fellowship in reproductive endocrinology, or my 16 years of clinical experience prepared me for what I encountered on a sweltering August afternoon in 2023. What I witnessed that day challenged not just my understanding of hormones but the very foundations of what modern medicine believes about aging, cellular regeneration, and the limits of human biological potential. The case that would ultimately end my career began at 2:47 p.m. on August 15, 2023. I remember the exact time because I was reviewing lab results for a complex diabetes case when my research coordinator Maria Gonzalez knocked on my door. Maria had worked with me for 8 years, and in all that time I had never seen the expression on her face that I saw that afternoon, a mixture of genuine confusion, concern, and something approaching fear. "Dr. Hayes, we need to discuss the Brennan case immediately. The lab results, they don't make sense. I mean, they really don't make sense." Maria had processed thousands of hormone panels during her tenure with me. She'd managed complex research protocols involving rare endocrine disorders, coordinated with laboratories across the country for specialized testing, and helped me navigate some of the most challenging cases in modern endocrinology. If Maria Gonzalez was confused by lab results, something was seriously wrong. "What's the issue?" I asked, minimizing the diabetes case file and pulling up the electronic record she was referring to. Isabella Brennan, 67-year-old retired art teacher from Sedona. Her family doctor referred her for what appeared to be standard age-related hormonal decline. Her daughter brought her in because she was concerned about some recent changes. But Dr. Hayes, you need to look at these numbers yourself. I've run them 3 times through 2 different labs, and the results are identical. They're impossible. Isabella Brennan had been brought to our clinic by her daughter, Rebecca, who was deeply concerned about her mother's recent dramatic changes. According to the intake notes prepared by our nurse practitioner, Sarah Chen, Isabella had been showing typical signs of postmenopausal aging over the past few years following her husband's death from cancer. She went through a really rough period after Dad died, Rebecca had explained during the initial consultation. Mom is 67, and for the last 3 years she's been struggling with everything you'd expect. Low energy, weight gain around her middle, trouble sleeping, joint aches, that kind of general slowing down that happens as people age. Her skin was getting thinner, her hair was thinning out, and she just seemed to be getting more fragile overall. This was a completely typical presentation for a postmenopausal woman experiencing the normal hormonal changes that occur as estrogen, progesterone, and other key hormones decline with age. Nothing unusual, nothing that would raise red flags for an experienced endocrinologist. But then Rebecca continued, starting about 4 months ago, everything changed. And I mean everything. Mom started having more energy than she'd had in years. She lost 25 pounds without trying. Her skin started looking better, tighter, less wrinkled. Her hair got thicker and started growing faster. She joined a hiking group and is now leading 8-mile hikes through the desert. Last week, she asked me if I thought she should start dating again. Sarah Chen, our nurse practitioner who had conducted the initial assessment, had made detailed notes about Isabella's appearance. Patient appears significantly younger than stated age. Skin elasticity excellent, muscle tone above average for demographic, hair thick and lustrous with minimal gray, posture erect, gait confident, energy level and enthusiasm remarkable for 67-year-old woman. I initially assumed we were dealing with a possible endocrine tumor, perhaps an ovarian tumor secreting hormones, or a pituitary adenoma causing unusual hormonal surges. These cases, while uncommon, do occur and can sometimes create dramatic physical changes in postmenopausal women. I'd seen similar presentations before, though usually not quite this dramatic. But when I sat down to review Isabella's comprehensive hormone panel, I realized we were dealing with something that challenged every principle of endocrinology I had learned over nearly 2 decades of practice. Isabella Brennan's hormone panel showed levels that were not just unusual for a 67-year-old postmenopausal woman, they were medically impossible. Estradiol, 180 pg/ml, normal for her age, 130 pg/ml, normal for her age. Post-CISDAF punched up, normal for reproductive years. 30 delondron was forcible progesterone, 12.8 non-grop would mondolondron was 40 delondron normal for reproductive years, 5 to 20 non-grop growth hormone, 8.7 non-grop growth hormone, 8.7 non-grop growth hormone, 8.7 non-grop growth hormone, 2.0 non-grop growth hormone, 12. Adults, 1 to 10 non-grop growth hormone, DHEAS, 2080 mg DL, normal for her age, 2080 mg DL, growth hormone, DHEAS, 2080 mg DL, growth hormone, 2080 mg, growth hormone, DHEA, 130 dolondron was 40 dop, growth hormone, 8.7 non-grop, growth hormone, 8.7 non-grop, growth hormone, 8.7 non-grop, growth hormone, 8.7 non-grop, growth hormone, DHEA, 130 dolondra normal for her age, 20 dolondra normal for young adults, 20 dolondra normal for 1 to 2, normal for young adults, 200-500 mg DL, thyroid hormones, T3 and T4 levels in the optimal range, typical of a healthy 25-year-old cortisol, perfect circadian rhythm with healthy morning peaks and evening lows, melatonin, robust nighttime production, typical of someone decades younger.
But it wasn't just the individual numbers that were shocking. It was the pattern. Isabella's entire endocrine system was functioning at the level of someone 40 years younger. Her reproductive hormones were at levels typical of a woman in her late 20s. Her growth and metabolic hormones suggested the cellular regeneration capacity of someone barely out of their teens. Her stress hormones showed the resilience pattern of a young adult. Most significantly, her ovaries appeared to be functioning as if she had never gone through menopause. In fact, according to these lab values, Isabella Brennan was hormonally equivalent to a woman at the peak of her reproductive years. "Maria, there has to be an error," I said, staring at the computer screen. "Run these tests again, using a fresh blood sample, Send them to both Phoenix General's lab and the specialty endocrine lab in Scottsdale. I want confirmation from 2 completely independent sources. Dr. Hayes, I already did that. Twice. 3 different labs have now confirmed these results. I also had Dr. Peterson from the main lab personally review the testing protocols to make sure there wasn't a processing error. Everything checked out perfectly. Dr. James Peterson was the most experienced lab director in Arizona, with over 25 years of experience in hormone testing. If he had personally verified the results, the likelihood of a technical error was essentially 0. When I first met Isabella Brennan in examination room 7 2 days later, I immediately understood what her daughter and our staff had been trying to tell me. This was not a typical 67-year-old woman. From the moment she walked into the room, everything about her presence suggested someone decades younger. Her handshake was firm and confident. Her posture was perfectly erect without the slight forward lean that typically develops as people age. Her skin had the elasticity, color and texture of someone in their 30s. Her hair, which Rebecca insisted had been gray and thinning just months earlier, was now thick, lustrous and predominantly dark brown with only scattered silver strands. But it was her eyes that were most striking. Isabella's eyes had the brightness, clarity and energy that you typically see in young adults. That sense of vitality and possibility that tends to fade as people age and experience life's disappointments and physical limitations. Mrs. Brennan, I'm Dr. Hayes. I understand you've been experiencing some unusual changes recently that have your daughter concerned. Isabella smiled with a confidence and energy that seemed to light up the room. Dr. Hayes, I have to tell you, I feel absolutely incredible. Better than I have since my 20s. My daughter thinks something's medically wrong with me, but honestly, I haven't felt this good in decades. I'm stronger, more energetic, sleeping better, and I feel like I've gotten a second chance at life. I performed the most comprehensive physical examination I had ever conducted on a patient. Isabella's muscle mass and tone were remarkable for someone her age. Her reflexes were quick and sharp, showing none of the gradual slowing that typically occurs with aging. Her cardiovascular system showed the efficiency and resilience of someone half her age. Her blood pressure was 110 Sullivan's, optimal for any age. Her resting heart rate was 58 beats per minute, typical of a well-conditioned athlete. When I tested her grip strength using our digital dynamometer, a reliable indicator of overall physical decline in elderly patients, Isabella scored in the 90th percentile for women aged 25 to 35. Her balance, coordination and flexibility were all exceptional. Mrs. Brennan, I need to ask you some detailed questions about when these changes began and what might have triggered them. She thought carefully, clearly wanting to provide accurate information. I'd say that the changes started becoming really noticeable about 4 months ago, but looking back, I think they actually began around 6 months ago. I was going through a really difficult period after my husband David's death. The grief was overwhelming, and I was feeling every day of my 67 years plus some. Can you be more specific about when you first noticed feeling different? It was April 18th. I remember the exact date because it was the 3rd anniversary of David's death, and I had been visiting his gravesite the day before, feeling pretty sorry for myself, and really conscious of how old and tired I felt. But that morning, April 18th, I woke up, and something was different. I felt energized, like someone had given my body a complete tune-up overnight. What was different specifically? Everything. I got out of bed without the usual aches and pains. I looked in the mirror, and my skin looked better. I felt strong. I went for what I planned to be a short walk, and ended up hiking for 3 hours through the red rocks around Sedona. 3 hours, Dr. Hayes. I hadn't been able to do that in years. Over the next 2 weeks, I ordered every diagnostic test available in modern endocrinology. I wanted to rule out every possible explanation for Isabella's impossible hormone levels before I was forced to confront the reality that we might be dealing with something that had no medical explanation. The tests included complete pituitary MRI with contrast to check for hormone-secreting tumors, ovarian and adrenal imaging to look for hormone-producing masses, comprehensive metabolic panel, including liver and kidney function, complete tumor marker panel, including cancer markers, genetic testing for rare endocrine disorders and hormone-resistant syndromes, bone density scan to assess the effects of her hormonal changes, cardiac stress test to evaluate her cardiovascular improvements, comprehensive cognitive testing to assess mental function, serial hormone monitoring over multiple days to track patterns and cycles. The results were both medically impossible and internally consistent. The MRI showed completely normal pituitary and brain structure, no tumors, no abnormalities, no signs of disease or dysfunction. Her ovaries, which should have been small and inactive after menopause, appeared enlarged and active, resembling the ovaries of a woman in her reproductive years. But there were no masses, no tumors, no pathological changes that could explain the hormone production. The tumor markers were all negative. Genetic testing revealed no mutations associated with hormonal disorders or hormone-resistant syndromes. Her bone density, which typically declines significantly after menopause, was in the range of a healthy 30-year-old woman. In fact, comparing her current bone density to a scan taken 2 years earlier, her bones had actually become denser and stronger. The cardiac stress test showed the cardiovascular fitness of someone decades younger. Isabella's VO2 max, a measure of aerobic fitness, was in the 85th percentile for women in their 20s. But the most significant finding was the serial hormone monitoring. Not only were Isabella's hormone levels impossibly high for her age, but they were showing the natural cyclical patterns of a reproductive age woman. Her estrogen and progesterone were cycling in a monthly pattern that suggested her ovaries had somehow resumed normal menstrual cycles, even though she had been postmenopausal for over 15 years. Dr. Sandra Liu, our chief of reproductive endocrinology and one of the most respected hormone specialists in the Southwest, personally reviewed Isabella's case. After spending 2 hours examining the patient and reviewing all the test results, she called me into her office for a private consultation. "Jonathan, I need to tell you something, and I want you to hear this from me directly. I've been specializing in women's hormones for 22 years. I've seen every type of ovarian tumor, every rare endocrine syndrome, every possible explanation for unusual hormone production in postmenopausal women. What's your assessment? Isabella Brennan's hormone profile is not just unusual, it's impossible. Her ovaries are producing hormones at levels and in patterns that suggest they've somehow returned to premenopausal function. But ovaries don't just restart after menopause. Once the follicles are depleted, they're gone forever. That's basic reproductive biology. Could there be some rare condition we're missing? I've consulted with colleagues at Harvard, Mayo Clinic, and UCSF. I've reviewed every case report in the medical literature for the past 50 years. There is no documented case of spontaneous ovarian reactivation in a 67-year-old woman. It doesn't happen. It can't happen. But she's sitting in our clinic with perfect hormone levels. That's exactly my point. We have a patient who is experiencing something that modern medicine says is impossible. Her entire endocrine system has somehow reset itself to function at the level of someone 40 years younger. We have no explanation for how this could occur naturally. Over the next month, I monitored Isabella closely with weekly appointments and frequent lab draws. Her hormone levels remained consistently optimal. Her physical improvements continued to progress. She was gaining lean muscle mass while losing fat. Her skin continued to improve in texture and elasticity. Her hair grew faster and thicker. According to Rebecca, Isabella's cognitive function and memory were sharper than they had been in years. "Dr. Hayes," Isabella told me during one of our follow-up appointments, "I know this sounds strange, but I feel like I'm aging backward. My joints don't ache anymore. I sleep like a baby. I have more energy than my 35-year-old daughter. Yesterday I joined a rock climbing group, and I was keeping up with people half my age." The most disturbing aspect of Isabella's case was that we had eliminated every conventional medical explanation. No tumors, no medications, no supplements, no genetic abnormalities, no environmental factors that could account for her transformation. Isabella Brennan's body had somehow spontaneously reset its hormonal clock by 4 decades, and modern endocrinology had absolutely no explanation for why or how this could occur. "Have you experienced anything unusual in the months before these changes began?" I asked during what I planned to be our final appointment. "Any illnesses, accidents, significant stress events, or changes in your life?" Isabella was quiet for a long moment, looking out the window of my office toward the desert landscape surrounding Phoenix. "Well, there was one thing, Dr. Hayes. It might sound silly, but the night before I started feeling different, April 17th, I had the most vivid dream I've ever experienced. Can you describe it? I dreamed about my husband, David. He died 3 years ago after a long battle with pancreatic cancer. In the dream he was young and healthy, the way he was when we first met 45 years ago. He told me that I had been mourning too long, that I still had so much living to do. He said my time wasn't finished, that I needed to rediscover the woman I had been before grief and aging had worn me down. What happened in the dream?"
David took my hands and said something I'll never forget. "Bella, your body remembers how to be young. Let it remember." When I woke up the next morning, I felt like I had been physically transformed. It was as if my body had somehow heard his words and decided to listen. I documented everything meticulously in Isabella's medical record.
Her case was medically impossible according to everything I had learned in medical school and residency, but the evidence was undeniable. A 67-year-old postmenopausal woman had somehow achieved the complete hormonal profile of someone in their 20s, with no medical intervention, no identifiable cause, and no precedent in medical literature. As Isabella's case became known within our medical center, colleagues began requesting consultations and case reviews. Dr. Michael Rodriguez from our geriatrics department wanted to study her cellular aging markers for his research into longevity. Dr. Michael Rodriguez from our geriatrics department wanted to study her cellular aging markers for his research into longevity. Patricia Chen from our oncology division was fascinated by her cellular regeneration patterns and wanted to understand if her hormonal reset had implications for cancer prevention. The hospital's research ethics committee requested a formal presentation of her case, but I was becoming increasingly uncomfortable with the attention Isabella's case was generating. She wasn't a medical curiosity or a research subject. She was a patient experiencing something profound that challenged our fundamental understanding of human physiology and aging. More troubling, I was beginning to suspect that Isabella's case might not be as unique as we initially thought. During my formal presentation to the medical staff, Dr. Robert Steinberg, our chief of internal medicine and a physician with over 30 years of experience, asked the question that had been troubling me since the day Isabella walked into my office. Dr. Hayes, if this type of spontaneous hormonal reset is possible in one patient, how many similar cases might we have missed over the years? How many older patients experiencing unusual energy increases, physical improvements, or what we might dismiss as good days, could actually be undergoing similar hormonal transformations that we failed to recognize or investigate? That question would haunt me for the rest of my career. How many patients had I seen over 16 years who reported feeling unusually good, or more energetic than usual, whom I had dismissed as experiencing placebo effects, seasonal improvements, or psychological changes? How many opportunities to document and understand this phenomenon had the medical community missed because the results seemed too impossible to be real? 2.5 weeks after my presentation to the medical staff, I received a phone call that would change the entire trajectory of my career. Dr. Lisa Martinez from our satellite clinic in Flagstaff called with urgency in her voice that I had never heard before. "Jonathan, I need you to drive up here immediately. I have a patient I need you to evaluate personally, a 63-year-old woman named Catherine Valdez. Her hormone levels are showing the exact same impossible pattern you documented in the Brennan case. This can't be a coincidence. Are you certain the lab results are accurate? I've confirmed them through 3 different laboratories, just like you did with Isabella. Catherine's entire endocrine system is functioning like she's 25 years old. Her ovaries have somehow reactivated after 12 years of menopause. She's experiencing the same physical transformation: weight loss, muscle gain, improved skin, increased energy, cognitive improvements. Everything. When did her changes begin? That's the really strange part, Jonathan. Catherine says her transformation started on April 18th, the exact same date Isabella Brennan reported her changes began. As I hung up the phone and prepared for the 2-hour drive to Flagstaff, I felt a chill that had nothing to do with the air conditioning in my office. If 2 women in different cities had experienced identical impossible hormonal transformations beginning on the same date, we were potentially dealing with something far more significant than an isolated medical anomaly. But I also realized that if the medical establishment couldn't explain these cases using conventional science, my career as a practicing endocrinologist might be in serious jeopardy. The medical community doesn't respond well to physicians who document impossible phenomena, especially when those phenomena challenge the fundamental assumptions of their field. The drive from Phoenix to Flagstaff takes approximately 2 hours through some of Arizona's most beautiful desert and mountain landscapes. Under normal circumstances, it's a drive I enjoy, a chance to clear my head and think through complex medical cases. But as I drove north on Interstate 17 that afternoon, my mind was racing with possibilities and implications that I wasn't sure I was ready to confront. If Catherine Valdez's case matched Isabella Brennan's pattern exactly, including the same onset date, we were dealing with something that went far beyond individual patient anomalies. 2 women, 67 and 63 years old, living in different cities 150 miles apart, both experiencing identical hormonal transformations beginning on the same date, with no apparent connection between them. The scientific part of my mind was trying to find rational explanations, environmental factors, some kind of contamination or exposure that could trigger hormonal changes,
a pharmaceutical contamination that might cause these effects. But I had investigated all of those possibilities with Isabella and found nothing. Could there be some kind of genetic factor that predisposed certain women to spontaneous hormonal reactivation? But Isabella's genetic testing had shown no abnormalities. And what were the odds that two genetically predisposed women would experience the same transformation on the same date? As I drove through the Sonoran Desert, watching the landscape change from desert floor to pine forests as I gained elevation, I couldn't shake the feeling that Catherine Valdez would not be the last case. Something told me that Dr. Lisa Martinez's phone call was just the beginning of a pattern that would ultimately challenge everything I thought I knew about aging, hormones, and the limits of human biological potential. Dr. Lisa Martinez met me in the parking lot of the Flagstaff Medical Center at 4:30 p.m. Lisa and I had worked together during our residencies at Mayo Clinic, and I had never seen her as shaken as she appeared that afternoon. "Jonathan, thank you for driving up here so quickly. I need you to know that Catherine Valdez's case is not just similar to Isabella Brennan's, it's identical in every significant detail. Same hormone levels, same physical transformation pattern, same timeline, same absence of any medical explanation. Have you been able to rule out the standard causes? Everything. Tumors, medications, supplements, genetic factors. Just like your case, we have a woman who has experienced a complete hormonal reset with no identifiable cause. But there's something else, Jonathan, something that's really disturbing me." "What is it?" "Catherine mentioned having a vivid dream on the night of April 17th, just like your patient did. In her dream, she was visited by her deceased mother, who told her that she had more life to live and that her body knew how to be young again. As we walked into the medical center, I realized that my career as an endocrinologist was about to change forever. Because if two patients had experienced identical impossible transformations beginning on the same date, preceded by similar dreams, we were dealing with something that modern medicine had no framework to understand or explain. And that's a realization that can either drive a doctor to make groundbreaking discoveries or drive them out of medicine entirely. What I would discover during my examination of Catherine Valdez would confirm my worst fears and set in motion a chain of events that would ultimately force me to make the most difficult decision of my medical career. Because when the impossible happens once, it's an anomaly. When it happens twice in the same way, at the same time, it's a pattern. And patterns in medicine usually mean that what you're seeing is just the beginning of something much larger and more significant than you initially realized. The question that would haunt me for months to come was this: how many other women were experiencing the same transformation? And if this phenomenon was more widespread than just two isolated cases, what did it mean for our understanding of aging, hormones, and human potential? As I prepared to examine my second impossible patient in less than 2 months, I couldn't shake the feeling that my days as a practicing endocrinologist were numbered. Because sometimes, when you witness medical impossibilities, you're forced to choose between your career and the truth. And I was beginning to suspect that choice was going to be more difficult than I ever imagined. Catherine Valdez was waiting in examination room 3 when I arrived at Flagstaff Medical Center. Like Isabella, she appeared decades younger than her 63 years. Her transformation was identical: vibrant skin, thick hair, perfect posture, and an energy that radiated from across the room. "Mrs. Valdez, I'm Dr. Hayes. I understand you've been experiencing some remarkable changes." "Dr. Hayes, I feel like I've been given a second life. 4 months ago, I could barely climb a flight of stairs. Now I'm hiking the Grand Canyon trails with people half my age." Her hormone levels were indeed identical to Isabella's, impossible levels for a postmenopausal woman. But what disturbed me most was her dream on April 17th. Her deceased mother had told her the exact same thing: "Your body remembers how to be young." Over the next 3 months, Dr. Martinez and I documented 7 more cases across Arizona, all women between 60 and 72 years old, all experiencing identical hormonal transformations beginning April 18th, all reporting similar dreams about deceased loved ones, telling them their bodies remembered how to be young. The medical establishment's response was swift and brutal. Hospital administrators questioned my competence. Colleagues avoided me in hallways. Medical journals rejected my case reports without peer review. "These cases are medically impossible." Dr. Patricia Harris, our chief of staff, told me during a closed-door meeting. "You're damaging the hospital's reputation by continuing to promote pseudoscience." I couldn't let it go. Working nights and weekends, I documented 23 confirmed cases across Arizona, New Mexico, and Nevada. Every case showed the same pattern: women aged 60-75 complete hormonal reset to age 25 levels, transformation beginning April 18, 2023, preceding dreams about remembering youth. No medical explanation possible.
When I tried to present my findings at the American Association of Endocrinologists conference, my speaking invitation was revoked. Research funding was pulled. Colleagues stopped referring patients. The case that ended my career wasn't medical, it was personal. My own 68-year-old mother, Dr. Eleanor Hayes, a retired pediatrician living in Tucson, called me on July 15th. "Jonathan, I need to see you professionally. Something impossible has happened to me." Mom's hormone levels showed the same impossible pattern. Her transformation had begun on April 18th. Her dream featured my deceased father telling her she had more living to do. Watching my own mother experience something I couldn't explain or treat broke my confidence completely. How could I practice medicine when I couldn't understand what was happening to my own family? I submitted my resignation on September 3, 2023. 23 documented cases of impossible hormonal transformation, and not a single colleague willing to investigate seriously. "Jonathan, you're making a mistake," Dr. Harris said during my exit interview. "These anomalies happen. You can't abandon your career over unexplained cases." Patricia, 23 women experienced identical impossible transformations on the same date. That's not an anomaly, that's a phenomenon. And if medicine can't investigate phenomena because they challenge our assumptions, then maybe I don't belong in medicine. I now work as a health consultant in rural Montana, far from the politics of academic medicine, but I continue monitoring the women from my research. All 23 remain healthy, vibrant, and biologically decades younger than their chronological ages. Isabella Brennan, now 68, recently completed a marathon. Catherine Valdez is learning to rock climb. My mother has returned to volunteer medical work with the energy of someone half her age. What happened on April 18, 2023? Why did these women's bodies suddenly remember how to be young? How many other impossible medical phenomena are dismissed because they don't fit our current understanding? The medical establishment prefers to ignore what it can't explain. But I witnessed 23 women experience something that modern endocrinology says is impossible. They're living proof that human biology has capabilities we haven't begun to understand. Sometimes the most important medical discoveries come from admitting we don't have all the answers. I lost my career documenting something impossible, but I gained something more valuable, the knowledge that human potential extends far beyond what we currently believe possible. The women who remembered how to be young changed my life forever. And somewhere out there, I suspect more impossible transformations are happening to people whose doctors aren't brave enough to document what they can't explain. Some mysteries are too important to ignore, even if they cost you everything.